When a Wyoming infant, toddler, or preschooler fails his or her hearing screens, parents oftentimes find themselves confused as to the next step required of them and needed for their child. They may have many questions as to where, when, who, and how to schedule an age-appropriate pediatric audiological evaluation. In this video, we will take a close look at what a pediatric audiological evaluation is. We will describe the current protocols, the battery of tests that, if followed, allow parents to understand what their child can and cannot hear. Once parents have information about what their child can and cannot hear, they will then be able to create an early intervention program designed to help their child thrive. We will discuss the importance of the written reports supplied to the parents by the audiologist who has done the hearing evaluation, and we will also discuss the variety of professionals and specialists that parents may meet with while obtaining a hearing evaluation for their child. Finally, we will discuss Wyoming's early hearing detection and intervention pediatric audiology specialty clinics and how parents and professionals can access additional support and resources for children with hearing loss. By knowing what to do next and by understanding what is required to not only help a child develop speech and language, socially and cognitively, parents and professionals can succeed in designing an appropriate plan of action. This plan of action will be dependent upon obtaining reliable and accurate results for the hearing ability for each of the child's ears. Securing an appointment for your child with an audiologist who works well with children and their families and who has the necessary training, equipment, and experience is critical.
At first you kind of feel hopeless and lost. You know, we didn't know anything about sign language or hearing loss, and at first we were like, how do we do this to provide a good life for him?
These professionals have given us a guide, a road to follow so that we know how to get there and what our end goals are with Carter.
It is important to understand that failed hearing screenings are not a diagnosis of hearing loss. Instead, they are an indication that a child is in need of a complete hearing evaluation to determine what the child can or cannot hear. Having complete and accurate information regarding a child's hearing ability is necessary in order for parents to make knowledgeable decisions pertaining to their child's future. Pediatric audiological evaluations are comprised of a battery of age-appropriate tests designed to establish an understanding of a child's ability to hear in each ear. By identifying specific information about each ear, it can be determined whether a hearing loss is present, and, if a hearing loss is present, how severe is the hearing loss? What sounds can be heard, and what sounds cannot be heard by the child? Is the hearing loss medically treatable? Is it permanent? Is it fluctuating? Will it get worse? Will it stay the same? And lastly, how might a hearing loss affect speech and language acquisition and social, emotional, and cognitive development?
Pediatric audiological evaluations are important because it is one of the very critical steps for a family to be able to get accurate information about what the child is able to hear, what the child is not able to hear, and then to be able to plan the management for that hearing loss based on the information that is obtained. For the sake of maybe sounding like a broken record, it is so important for those little people to be screened by 1 month of age, to be diagnosed appropriately, accurately, and from a trusted source by 3 months of age, so that the very critical piece of entering early intervention can happen by the time that child is 6 months of age.
What should parents expect during an evaluation, and what should professionals provide? Making an accurate and reliable diagnosis about a child's auditory system requires properly gathering and interpreting specific information. This means that professionals must use a variety of age-appropriate tests during an audiological evaluation. This process includes and typically begins with a complete case history. Case histories provide valuable information. Not only do they introduce the audiologist to the child's hearing screening results, they give the audiologist a firm place to begin the diagnostic testing. The case history may identify a potential family history of hearing loss and can also point to any potential risks that may affect a child's hearing at a future time. By using a case history to become familiar with pertinent birth information, as well as the results from any previous screenings, a pediatric audiologist can better determine which appropriate testing procedures should be performed first. After the completion of a case history, the audiologist may complete a visual examination of the child's external ear, ear canal, and tympanic membrane through the use of an otoscope. Following otoscopy, the visual inspection of the ear, the audiologist will begin to administer a recommended battery of age-appropriate tests. The Joint Committee on Infant Hearing recommends using a combination of electrophysiological and behavioral tests. These test protocols are chosen depending upon the child's age, level of activity, and ability to be conditioned to respond to sound. An experienced pediatric audiologist will be familiar with the administration and interpretation of these test protocols. Some of the tests administered to your child will include otoscopy, otoacoustic emissions, or OAE, emittance, also known as tympanometry, acoustic reflex, auditory brainstem response, also known as ABR, and auditory steady-state response, or ASSR. Otoacoustic emissions, or OAE, is a painless test that uses a small, flexible tip inserted into a baby's ear. As sound is delivered to the ear, a microphone records the otoacoustic emissions, or the echoes, produced by the cochlea. This procedure can be performed while the baby is sleeping. However, it can also be performed while a child is awake if the child remains relatively calm and still. Emittance, also known as tympanometry, is the test that helps determine how the middle ear is functioning. Emittance is not a test of hearing. Instead, it is a test of middle ear status. Middle ear status can change depending upon the absence or presence of healthy eustachian tube function. Depending upon the age of the child, the audiologist will choose to use either high-frequency or low-frequency probe tones while conducting emittance testing. Acoustic reflex is a procedure that can be used to determine the absence or presence of the stapedial muscle reflex in response to sound presented to the ear. Auditory brainstem response, also known as ABR, is a test that measures the brain's activity in response to sound. This test gathers information about the condition of the peripheral and central auditory systems. Like OAEs, small insert phones are placed in a baby's ear to deliver sounds. The use of sensors placed on the baby's forehead and behind the ears gathers data. This data offers an objective measure of a child's ability to hear. ABR results are especially helpful in the identification of the amount, type, and configuration of hearing loss in each individual ear. However, the ability to obtain valid ABR results is directly related to the level of wakefulness of the child. The best ABR results are acquired while the child sleeps soundly. Parents may be asked to bring their child to the evaluation appointment ready to be fed and ready to go to sleep. Some facilities choose to use sedation in order to greatly increase the probability of obtaining accurate ABR results. Therefore, parents may be interested in inquiring about the use of sedation at evaluation facilities. Auditory steady-state response, or ASSR, is a measurement that also helps in determining a child's hearing status. ASSR results are especially helpful in providing information for children who have severe to profound hearing loss. Pediatric audiologists may also make use of behavioral audiometry methods during your child's evaluation. However, behavioral audiometry methods such as observational audiometry, visual reinforcement audiometry, and condition play audiometry require an evaluator who is experienced and seasoned in working with the pediatric population.
The younger you can have your child evaluated, the better. Typically, the child's behavior is going to dictate how well the appointment goes. So for newborns, they're sleeping most of the time anyway. It's great to have them go to the appointment, probably have them be a bit hungry when they get there, maybe have them the appointment scheduled at the time of their typical nap, which of course for newborns can always be changing. So it's best to see if you can keep them awake, especially in the car on the way to the appointment. If you're coming from a distance, some parents will choose to travel the night before. Get their child up, have them be awake, so that when they get to the appointment, if they feed the child, that little person is going to say, oh, my tummy's full, now I'm going to just have a really good nap on mom or dad's shoulder while my hearing is being evaluated. For the toddler, you want them to be well rested, ready to play, have a bit of an excitement going on, that they feel secure about what they're going into. You can have visited with them a couple days ahead of time, or telling them that we're going to go play some games, and to be the parent portraying that it's going to be a pleasant time, a good time, that we want to differentiate it from anything that might be painful or so on, because it should be just very, very pleasant and fun. The child should be well rested. You might want to bring some snacks along. You might want to bring a favorite toy. You might want to make certain that the child has had a good nap, and we will all hope that it's a good day for the little kid.
As parents meet with specialists and professionals before, during, and after their child's pediatric audiological evaluation, they will undoubtedly receive a great deal of information. To help keep track of this information, it is important for both parents and professionals to receive a complete report of evaluation results. By consistently collecting and organizing information, parents will be able to provide professionals with information needed about their child. Likewise, it is imperative that audiologists spend time during the appointment to explain to parents, using understandable terms, the results obtained during the evaluation. This important step will enable parents to understand the results of their child's evaluation, the recommendations, and the agreed-upon next steps. In addition, the audiologist should also provide his or her contact information to the parents so the family has a resource available to them should questions, comments, or concerns arise in the hours, days, or weeks following the appointment. Therefore, an accurate and age-appropriate evaluation must always result in a clearly written and understandable report that can be shared with parents, early interventionists, medical providers, and other professionals involved with the child and family. A useful written report will contain 8 key points, including basic patient demographic information, such as patient's name, date of birth, gender, contact details, physician information, referral reason, and the evaluation date. Number 2, pertinent information obtained during a case history. This information typically includes whether or not there is a history of hearing loss in the family, pertinent birth information, and any hearing screening results. Number 3, a list of the tests completed during the evaluation. Number 4, a list of tests that were not completed and the reason why. Number 5, ear-specific results for each test administered. For example, what the child can hear in the right ear and what the child can hear in the left ear. Number 6, an explanation of the child's activity level or wakefulness during the evaluation will also be included in a useful report. Was the child cooperative, relaxed, asleep, awake, or sick at the time of the evaluation appointment? Number 7. A summary section should clearly state the results of a complete diagnostic evaluation. Then lastly, number 8. The recommendation section should clearly describe the necessary next steps. It should include referrals to professionals and specialists, such as the child's primary care physician, additional audiology appointments, a speech-language pathologist, an early intervention provider, a teacher of the deaf, a geneticist, an otolaryngologist or ear, nose, throat doctor, and a parent advocate or local Hands and Voices chapter for further support. This recommendation section should be comprehensive and understandable to both parents and other professionals. Parents should also be encouraged to ask for any further clarification regarding their child's evaluation. For example, parents may want to ask, "How much hearing loss does my child have? What do the terms conductive, mixed, sensorineural, etc. mean? Does my child need hearing aids? A cochlear implant? What will my child hear with hearing aids? When should I begin early intervention? Will somebody be able to help me learn about the different types of communication options? Is there a parent support group in my area?" Please visit wyomingedi.org for a full list of relevant questions to ask your pediatric audiologist.
For a family and for an early interventionist to understand a child's hearing loss, they have to have a report that tells what was done, what those tests mean, and then beyond that, what are that audiologist's recommendations for that child. And from an early interventionist standpoint, if you know the recommendations directly from the audiologist, you're able to support that family through the process and make sure they follow through with the recommendations and help them really understand the child's hearing loss. In Wyoming, after a child's diagnosed with a hearing loss, of course the parents of that child are going to meet a variety of professionals, and all those professionals there are there to support that child and support that family through the process of early identification, early amplification, early intervention. And it can feel very overwhelming to a family because there are so many people and lots of advice that's being given. But what I want parents to know, what is very important for parents to know, is that all those professionals are there to support them. And the support is there in Wyoming for children who have hearing loss and their families. Everything that you need is here in Wyoming.
I would definitely say the information they got from the initial evaluation day is definitely helpful. It was very comprehensive.
Nancy even drew us a picture. She drew us a little diagram of his cochlea and his ear, and that really helped me. And most of the professionals that we deal with still use that information from that day up to this point. I think it was a really good starting point. They gave us a really good base that day. Giving us as much information as we could possibly handle the first day was extremely important. The audiologist gave us a notebook that we were to take home, and that notebook is actually still helping us today. It gave us tabs that had resources and contact information and just general information that we could use to take home with us. And we still use that notebook, and we put all of our information in it, and we organize all of our stuff that way, and it was really great. We had two audiologists there, and one was very technical, and the other woman put it all in more simplistic terms for us to understand.
Kind of broke it down.
Yeah, it was more of a team effort. It really helped.
Parents may not initially realize how important it is to seek and find a dependable pediatric audiologist. But by obtaining a complete and accurate diagnosis, parents will have the information they need to successfully collaborate with early interventionists and put a plan in place that supports their child's healthy growth and development. Pediatric audiology specialty clinics are offered in both Casper and Laramie approximately 7 to 8 times per year. These pediatric audiological diagnostic clinics provide families with an opportunity to work with a team of professionals who offer a range of services that includes age-appropriate audiological testing, evaluation of a child's speech and language development, and suitable recommendations for ongoing support. And as always, the Wyoming Early Hearing Detection and Intervention Program remains available to answer questions and offer guidance to parents and professionals caring for children with hearing loss.
And it was a turning point for everything in our lives right now. Our lives wouldn't be the way they are right now if it wasn't for that day. The day we were taken into the evaluation and we got the results was, I guess, our turning point. It made everything possible that we've done today, including him getting cochlear implants. It really made it obvious to us that we needed to do something about it. We got the diagnosis and we said, okay, what from this point, what's next? And we went from there.
Because language acquisition begins at birth, a child's early years provide a window of opportunity during which the foundation for future speech and language skills are formed. Therefore, the first 3 years in a child's life are essential to healthy auditory brain development and future academic success. So when a young child fails his or her hearing screens, it is vital to obtain a complete evaluation of that child's hearing. By doing so, that child may be afforded the opportunity to develop to his or her fullest potential. Parents are encouraged to contact their child's primary care physician or the Wyoming EDDie program for help in scheduling an age-appropriate pediatric hearing evaluation appointment when it is needed for their child. Minimizing or eliminating the delaying effects of hearing loss for a young child does not happen overnight. However, securing an accurate hearing evaluation is the critical first step. By simply establishing a place to start, families and specialists can work hand in hand to see to it that every child in Wyoming begins with a firm foothold on the path to great potential.